Title of today's talk is The Power of the Mind, and I've just been reflecting in the last 2 days on the power of the mind and also on the power of a TEDx talk, which I had the privilege of being a participant in Surrey, BC, just on Saturday a few days ago. So the themes that came out with the patients kind of tie in with the couple of cases within my TEDx talk. So I'm just going to share those with you tonight and hopefully can inspire and remind you of the power of the mind in our healing journey with chronic pain, whether it be yourself or whether it may be with our patients. So the first is a lady called Millie McConnell. She was a lady I met a few months ago who had the awful diagnosis of terminal stomach cancer, a rare form of stomach cancer. And she was given 3 months to live. And this was back in 2001. So Millie, within a minute or so of her diagnosis, she made a decision in her mind. And it was not to attach to the label of her diagnosis, but to create a mindset that would literally see her through her treatments, which was standard chemo, radiation, and also surgery, but on beyond that, because as according to her medical professional and the team, that she should not have survived with her diagnosis. But she was able to go ahead and not only go through this experience of treatment, but also beat it, and not just beat her cancer, but beat her pain, because she still gets pain. She gets chronic abdominal pain on a regular basis because of our post-surgical technique, our post-surgical complications of dumping syndrome, and she does get chronic pain, but she can control it literally within minutes, and it can go away. And this is how she does it. And this is the take-home message I had in my TEDx talk on one of the aspects of how to retrain your brain to reduce pain, which was the title of the TEDx talk. And it's this: number 1, let go of things you cannot change. 2, accept the situation, whatever it may be. And 3, tell yourself this is only temporary. No matter the situation with chronic pain, it's really important to let go of the situation in the mind that may be the stress or the worry or the looking past in the back and the past reasons maybe for pain, and just to basically let it go. It could be stress, it could be abuse, it could be a surgery, it could be an accident. You got to let go of that stuff because you cannot change it. You just simply cannot change the past. You can change the future, but you cannot change the past. So letting go is essential. And it's a modality that Millie uses every single time she has pain. The second modality there is accept the situation. You cannot change what is happening right now. And if you accept it without judgment, and without judgment is the key. Because when we don't judge, you don't cause stress in your brain. If you don't cause stress in your brain, you can allow your brain to heal. But if you get stress, you're just literally compounding the problem in the limbic system that feeds the autonomic nervous system, which then gives you more pain circuit activation and therefore more pain. So accepting the situation without judgment is absolutely essential. And the third thing is wonderful little tip is tell yourself this is only temporary. We need to do this with pain because chronic pain is a waxing and waning experience for most people. It comes and goes. It gets worse with stress, it gets worse with sometimes activity or worse with other things going on, and it gets better with other activities. And if you stop and you can breathe and you really get into a deep relaxation with the breath technique, you can really slow down your heart rate, slow down your pulse rate, slow down your mental activity, and as a result your pain can go down because you're triggering the relaxation response and you're reducing the pain response or the fight-flight response. So some time of slow, deep breathing exercises can be very helpful. And This is why we can say this is only temporary. So having that mentality and that approach is essential, in my opinion. And I've had the privilege of sharing that story many times with patients, and even this week, sharing it with them. So the second case that I shared in my TEDx talk was Julie Clare, 65-year-old lady with a gunshot wound to the right leg when she was 15. That was 50 years before today. She had a gunshot wound, and as a result had chronic pain in her amputation site. Unfortunately, due to complications, her leg was amputated, and she had stump pain in the flesh part of her wound for basically 49 years until I met her. She tried all kinds of treatments, traveled across the world. She was on opioids, she was on a variety of other treatments, and with very little results. And her pain was awful. It was searing. It was like, she describes it as scraping on the sidewalk, and an intense pain. So once I share with Julie that she controls her pain through her stress levels and how she thinks, and how we can change that through positive affirmations, then Julie Clare was on her way, and she moved well beyond the belief, the permanent belief that the pain was not going to go. And she moved into this positive affirmations, and she was so dedicated and committed to the mindset that she can control her pain as well. She did repeated positive affirmations daily, every day, all day, literally all day, every day. And in 4 short weeks, her pain was gone. Quite remarkable. You know, I don't have many patients who can testify to that. But she showed the power of the mind by locking in a belief system that her pains can change. And it's not this fanciful idea that it just disappears. No, we're actually setting down nerve circuits in the brain when we have repeated affirmations, and we're literally laying new, like, road tracks, as it were, for the car to drive, or new nerve circuits for the nerve signals to pass down from the brain all the way down to the body. And Julie Clare, in 4 weeks, her stump pain was gone, and it remains gone, and has been gone since that 4-week stage. You know, she still gets pain in other areas at times, but she's learned to control it in those areas too. But regarding the stump pain, it's gone and it hasn't come back. What a testimony to the power of the mind. You know, you can choose any affirmation you like. The one I love is Emile Coué's one from France, and it's this: every day, in every way, I am getting better and better. You know, I've shared this on the live streaming before, but you know, after spending 3 months preparing for this talk, and Julie Clare was always going to be one of the cases I was going to talk about, I've reflected on this story literally hundreds of times now by repeating this story and reflecting on the outcomes. I've seen Julie Clare in clinic several times over the last 3 months, and how she's doing remarkably well with other modalities in health. But her pain remains something that she's a champion of. She controls it, and she is a real you know, leader in the field, in my world, of how do you beat pain, how do you master it with the mind through the neuroscience of neuroplasticity. So that's what I've decided to share tonight. 2 case examples of ladies in my life who have mastered pain themselves, and they continue to do so with a mindset of positivity and an approach that they both are able to help people where they live and also around the world where they're in communication with them. So hopefully tonight this also will reach people around the world, can be a testimony to you all listening, that it is possible to end pain in some cases. I think in all cases it's not possible, but I think in some cases it is, and they are 2 good examples. So please leave your comments on this on my feed here. What would you like to hear about? So I'll just leave you with this thought, and just a final reminder: if you have chronic pain, please see your local physician or nurse practitioner, care provider for these subject matters. And this is an educational platform only. And at the end of the day, we need a collection of treatments often to help us, and different people on our team to help us as well. So thoroughly encourage that interaction with a healthcare professional. So I'll just end here. there we go. I'll leave it for now, and we'll talk on 7 days time. Thank you.